Are you living in pain? Is it joint pain or muscle pain? If so, stay tuned. Welcome to Living Pain Free with Dr. Marc Darrow from the Darrow Stem Cell Institute in West Los Angeles. This is the program that can give you effective solutions for the pain you've been living with. Dr. Darrow is a medical doctor, board certified in physical medicine and rehabilitation. He teaches about the use of prolotherapy, PRP, and stem cells. Today's program could open up a new life without pain for you. Now, here's Dr. Darrow with his co-host, Dr. Nita Valens.
Hi there, Dr. Darrow.
Hello, Nita Valens. How are you today?
I'm great. How about you?
I'm good. Living it up.
Yay, my favorite phrase. It's interesting that you say living it up because the show is called Living Pain Free, obviously, and we want our listeners to live it up and be pain free. So if you're having any kind of orthopedic pain, particularly chronic pain, please give us a call today on the program at 866-870-5752 right here in the studio. That's 866-870-5752. And when you phone, you will get Dr. Darrow's latest book for free called Stem Cell and Platelet Therapy, Regenerate, Don't Operate. It has actually 264 scientific studies. And pain in your muscles, pain in your joints, tendons, ligaments, discs, back pain, neck pain, knee pain, hip pain, arthritis pain. Perhaps you have carpal tunnel syndrome pain, tendonitis, stiff joints, dull aches, basically orthopedic pain. So please do give us a call. Do not suffer one more day. And we are here Saturdays at 10 a.m. and again at 1 p.m. And the other thing that you can do, besides calling in the program, is check out Dr. Darrow's website at www.lastemcells.com. That's www.lastemcells.com. You can email Dr. Darrow off of every page on the site, and you can watch him performing the treatments on videos. It's pretty exciting stuff, actually. And if you've been listening for a while and you'd like to call the office directly, they're answering all the time, and if not, they get right back to you at 800-300-9300. That's 800-300-9300. So I got a couple more things to say while this first call racks up. We have lines open for you right now, and again, that number is 866-870-5752 right here in the studio, just for you. So what do you think, Dr. Darrow?
Well, I have a question for you.
Sure.
What did the basketball say to the therapist?
Bounce me?
No, I feel empty inside.
Aww.
Isn't that cute?
That's very cute.
And where do basketball players get their uniforms?
They get their uniforms from their lockers. They magically appear all clean and pressed?
Well, maybe. From New Jersey.
Okay, what else you got?
Those are actually little jokes that one of my patients who came in, Vic and Marie, I know they're listening now, so that's for you guys. We love you very much, and thanks for the jokes. Keep sending them. You keep sending them, I'll keep telling them.
Yeah, I like it.
So what I want to talk about, let me see here if this caller is ready. No, not yet. I'm going to go to an email because, as you guys know who know me and listen to me, if you go to the website at www.lastemcells.com, every page has a spot to email me, and I get emails 24 hours a day from all over the world. So I guess people, I'm not sure where, south of the equator, are emailing me in the middle of my night, but when I get up in the morning, I answer. And I answer in between patients, and I answer at night and before I go to sleep, which is usually around midnight or so. So I'm working all the time and on weekends, other than when I'm out ready to go play golf, which I am right now. You can see those people who are watching the video can see me in my golf shirt and my golf hat. So I'm ready to get out. There's some good weather out there today. So this one says knees. This is an email. And it started out with the person saying, I work on my knees a lot as a handyman. Last year, my gait has been inconsistent and off balance, often catching my right toes on the ground. When getting up from working low, I get a catching and then popping sensation on the outside of my right knee. I recently purchased the Good Feet Orthotics. I'm not sure what that is. I didn't look it up yet. But last night I had a different popping around the mid-outside of the front knee. Did not immediately pop back into place, and I'm quite sore today. So that's very common. A lot of people come in the office and they go, I just woke up this morning with terrible knee pain or swelling. And that's typically from what we call patellofemoral syndrome, where the patella is worn down. That's the round bone in the front of the knee. And it wears out from doing squats and lunges and things like that, or jumping sports. And I just had I'm trying to think who it was. Actually it was one of my staff. Said, can you do PRP on my knees today? She texted me early in the morning. I said, yeah. I said, what's the problem? She said she didn't know. Their knees were just achy. So when I got to the office, I examined her, and she had this kind of a grinding noise in both of her knees, this grinding feeling that as doctors we call crepitus. So I said, I know her husband is a bodybuilder, and I said, have you been doing squats with your husband? She goes, yeah, I've been doing them for years. And I said, well, they have been wearing out the back of your patella. And as we bend our knee, the patella gets pushed deeper into what's called the trochlear groove, which is a little sliding area in the femur, the thigh bone. And that cartilage can wear out with a lot of pressure on it. So it's a very common thing that we see. And this particular person who wrote in works, as a handyman. He's on his knees a lot. He's squatting and stooping a lot. And he's probably just loosened up that trochlear groove and worn out the cartilage so that his patella can actually sublux a little bit. It's not quite a dislocation where it totally pops out, but it pops out a little bit, and then it can pop back in. Sometimes you'll see people, especially like soccer players, where you'll see them fall to the ground, and they have to pop that back in. It usually goes to the outside of the knee, and they'll take their palm and just slam it back in. So it happens to more Northern European people, Irish, Scottish, Norwegian, things of that nature. There's more laxity in the joints. So that's something that we can help with regenerative medicine, using your platelets from your blood or your bone marrow, getting your bone marrow stem cells and platelets from there. And we work around the patella. We go into the joint first. I use an ultrasound to look inside. Don't ever get an injection in your knee without an ultrasound, because they're guessing where the solution is going. And the studies show that at least 1/3 of the time they're not even getting the solution into the joint. And then I go around what's called the retinaculum, which is around the patella, to tighten it up, thicken up that tissue that holds it in place. So we get great results with that. Need anything to add about that?
Yes, I think that was an excellent explanation. I love when you talk about the exact etiology of how a body part works, because then you can visualize it and people understand it better. I love that. And our number is 866-870-5752. Right here in the studio, give us a call. I have lines open for you right now. Again, that's 866-870-5752. And check out the website also at www.lastemcells.com. That's lastemcells.com. You can email Dr. Darrow off of every page on the site, and you can watch videos of him performing the treatments. That's a real important element. I love that.
So I'd like you to call in and talk to me live. Unfortunately, most people call in at the end of the show when I don't have time to get to everybody. So if you want to talk to me, right now is the time. And I'm just going to say the number again. It's 866-870-5752. If you want to call the office and get more information that we don't talk about today, the number to the office is 800-300-0950. 9300. And if you want to watch me do videos, watch me do procedures on videos, you can just go to the website, which is www.lastemcells.com. So I'd also like to mention that I've been doing this work for, since my residency at UCLA. I started doing this, I think, in 1997 or 8. So I think I've done the most of just about anybody on the planet. That's what they tell me when I go to national meetings. And we get maybe 80 new patients a month that we work on. And most of them we have good success with. Occasionally people don't heal from this type of modality of using PRP, that's platelet-rich plasma or stem cells, for several reasons. The most common is that people cheat on me, meaning that I tell them,
love that.
well, it's true. They say, okay, I'll follow your directions, and then they don't, meaning that they'll go back to their sport right away without letting the area heal, whatever it is. And, it's kind of funny, Nita, because a lot of people, when I mention that I play golf, they go, that's not a sport. But probably I get as many golfers in the office as any other sport, even like basketball and football, because golf is a high-speed sport. You're swinging the club, if you're any good, at around 100 miles an hour and getting into positions that are very, very detrimental to the body. I get people who are golfers who have neck pain, shoulder pain, elbow pain, wrist pain, finger pain, hip pain, neck pain, back pain, knee pain, ankle pain, toe pain. I get the whole body. So every sport that's done repetitively can cause issues with the body. I tell people to continue doing their sports, but get fixed first. Get these areas healed first. The other thing that often is in detriment to healing is people won't do enough treatments. This is not a one-shot deal. Excuse the pun. These treatments are shots. It can be. I've had parts of my body that have healed overnight, and I've had parts of my body that have taken months to heal. And yes, I do inject myself when I'm injured. My patients go, how could you possibly do that? Well, it's easy. You just do it. And it's hard for me to find someone, even in Los Angeles, that knows how to do this correctly. The guys that take a weekend seminar and then hang up their shingle really have no idea what they're doing. And unfortunately, the chiropractors, who I love as chiropractors, should not be hiring nurses or nurse practitioners or things like that to be doing this for their patients, or doctors that don't do it for a living. And there's way too much of that. It gives our profession a terrible name because the results are not very good. They're inferior to those of us. There's only a few of us in town. I can think of, including myself, 3 right now that I would trust to do this. I don't trust orthopedic surgeons to do it. They should be doing the surgery, not the regenerative medicine. For example, I have patients come in who have had an orthopedic surgeon inject their shoulder with PRP or stem cells, didn't get better, and I ask, how many injections did you get on that shoulder? And they'll say, I got 1 injection. Well, good luck. When I inject a shoulder, I'm typically doing 30 or 40 different places. So be careful who you choose to do this for you. You need someone who is a specialist in this area, just like you wouldn't go to me to have surgery. Okay? I'm not a surgeon. I was trained in surgery. I was going to be an orthopedic surgeon. And then my boss during medical school did a shoulder surgery on me. I had a little impingement syndrome. And my arm came out like a balloon full of fluid. And I had a fever. And I decided that surgery was not going to be something I was going to pursue, that it caused more damage than good. I still feel that way for most cases. I don't think surgeons should be doing meniscal repairs in the knee, labral repairs in the hip, labral repairs or rotator cuff repairs in the shoulder. I think regenerative medicine using PRP, platelet-rich plasma, or stem cells is the way to heal that. There's very few side effects from the work that I do. Very, very few. People get stiff afterwards. And it was very funny. I injected my shoulder one day, and it got very stiff, and I got home, and I said to my wife, do we have any Vicodin? That's a narcotic. And she said, no. You want to get rid of that stiffness? Get in the hot tub. It'll get rid of it. She said, you're not taking any of that stuff. And it's true. You know, a lot of people jump to narcotics when they're in pain, but it's a very bad way of handling pain. And for those of you that are consistently, chronically taking narcotics, there are studies that show that narcotics actually upregulate the pain receptors. You end up having more pain and need more medicine, then you get addicted. I rarely give out narcotics. I will sometimes for a couple of days, but don't come to me if you want pills. I'm not a pill pusher, and I don't believe in them. The other thing I want to say is that although I've been doing the musculoskeletal regenerative medicine since the late 90s, we also have started doing facial or cosmetic regenerative medicine. So when we inject this into the face, and it's called, you won't forget this one, it's called the vampire facelift. And just as many men as women come in, believe it or not, to get this done. And we just inject platelets or stem cells into the face and regrow the collagen. And as we get older, you know, the face gets kind of gaunt. And this rebuilds it very, very quickly and makes people look young right away. We also can do it on the head to grow hair. And in my book, Stem Cell and Platelet Therapy, which we're going to give out for free if you call the show right now. And you can call us right now and talk to me at 866-870-5752. But in the book, there's a chapter on regenerative medicine for the face and for hair regrowth. If I do hair regrowth, I'm going to check out labs first, find out if things like dihydrotestosterone are too high. That's a hormone that could actually kill the hair follicle and put a man or woman in, a state of losing hair. So we want to keep those follicles alive. We've got to check the estrogen, testosterone, iron studies, thyroid studies, and things like that to see what the cause of the hair loss is.
Well, that makes sense, and that's becoming pretty common in America. Lots of people have hair loss. I wonder why that is. But
because we're living very long now.
Well, there's that. Well, let's hope we get some callers right now. The number is 866-870-5752. That's 866-870-5752 right here in the studio. Give us a call. I have lines open for you right this minute. And don't wait till the last minute. As Dr. Darrow was saying a while ago, we get all these calls at the last minute, and we don't want anybody to not get their turn. So call
You don't need
now.
to be shy. Use a fake name. It's okay. Say it's your sister, even if it's you.
They could say a famous fake name, and then we'll laugh.
That's right. That would be great.
Like
they
Benedict
could say
Arnold
that
or something.
Or Julius Caesar.
Right. Well, meantime.
We like to laugh.
We do. Let's go to Naomi in Los Angeles.
All right. Naomi, thanks so much for calling in. You have a 90-year-old father that's slowing down and had his knees replaced. And what is your question about that?
Well, I've noticed pretty much recently that he's been a little bit, has trouble with his balance and his walking.
Okay.
And he was fine before, so I don't know if it's something to do with, I'm trying to diagnose him myself, trying to see what it could be. His legs don't hurt him, but I don't know if it's something that maybe it's neuropathy that is happening there, and if it's something that something you can help him with.
Is he having any knee pain after the knee replacements?
No, he has not had any knee pain or hip pain.
Okay. How long ago were his knee replacements done?
I would say about 8 years ago.
Okay. So he was about 82 or so at the time.
Right.
And how recently has this imbalance been going on for?
I want to say it's been maybe about a year, maybe less than a year. but it seems
Okay.
like it's becoming more severe, and it seems like he feels like his legs are weak. So I don't know, but no pain. I asked him, "Do you have any pain?"
Okay.
No pain.
I'm sorry, you said he feels like what?
Like he has weakness in his legs.
A weakness. Okay.
Mm-hmm.
Okay, well, here's a few things going on. One is
Okay.
his testosterone is down to near nothing, okay?
Okay.
And when that happens, we become, I'll use the word feeble. There's studies on that with testosterone and aging. So the muscle starts to decrease and the fat starts to increase, and that's one of the issues. So there's studies that show that giving testosterone to the elderly is one of the safest things to keep them on their feet and from falling over and all that. So that's an issue. We know his testosterone is low, and we know that we could supplement it, very easily. You can get a shot in the butt once a week to keep the levels even. It could be neuropathy. There's a study called an EMG, a nerve conduction study, that can see if that helps. There's a blood test we do in our office called SpectraCell, and that shows if he's low in antioxidants, amino acids, vitamins, and things like that can cause neuropathies. So there's a lot going on. I'd have to examine him to see what's happening. I'm happy he doesn't have pain, which is amazing. I'm not sure that the work that
dry. And I mean, he drives.
Yeah, I get it.
He's like very upper body strength there. I mean, he does weight, but it doesn't make sense. With his legs. So
well, everything makes sense. We just don't know what the cause is of everything. We're not smart enough to know everything, but it makes sense when you figure it out. You just have to have someone figure it out. So, Naomi, what about your body? How are you feeling?
You know what? I'm pretty good. I feel pretty good.
Good.
No aches, no pain. I'm
wonderful.
Lucky.
You are. You're one of the lucky ones. So, Naomi, God bless you, and thank you so much for calling in. And we're going to go to Alexander at Porter Ranch. Alexander, how are you today?
Hi, Dr. Darrow. I'm okay. I wanted to ask you. I've been playing volleyball for like 30 years, and if you're familiar with that kind of sport, you can imagine how much pressure there is on the knees, as well as my shoulder. I'm righty, so obviously that's where the issue of concern is: my right shoulder, and my knees.
Okay. Well, first of all, playing volleyball for 30 years, I'll say it like this in a funny way: you deserve to have some problems with your knees, right, and your shoulder. You earned it.
Respectfully, I agree. I love the sport. I will never, I will never complain that, this is why I have the pain. I know why I have the pain. I'm not surprised.
Yeah.
However,
however, the question is, what can we do to fix it? And we probably can help you. The cartilage is probably worn down.
I've listened to your show.
Oh, good.
Yeah, I'm sorry.
Thank you. We can probably regrow enough of the tissue in your joints with PRP or stem cells or both to get you back feeling really good again. I don't know how many treatments it would take. It depends how worn down it is. People come in all the time and they go, I'm having pain. I've got some cartilage decrease, some arthritis. Should I do it now or wait till it's really terrible? And it's always best to do it now if you can, so that it's not harder to do it. Okay. So there's good hope for you. Have you had any? How old are you?
No, 38.
38?
Yes.
You're a babe.
And you're a babe. You shouldn't be having all this problem so soon, but it can happen. I think you need to get into the office. I'll give you the number.
Okay.
The number to the office, Alexander, the number to the office is 800-300-9300 if you want to come in. I'd love to see you and show you how you can use regenerative medicine to heal your knees and your shoulder. And we're going to the break. If you have more to say to us, Alexander, hang on. Otherwise, we'll get to Patrick after the break. God bless everyone. Thank you.
And you're listening to Living Pain Free with Dr. Marc Darrow. Grab a pen or a pencil, write down this important information about to come your way. I'm your host, Nita Valens, and we'll be right back.
You're listening to Living Pain Free with Dr. Marc Darrow. Dr. Darrow's practice is located at the Darrow Stem Cell Institute in West Los Angeles. To schedule an appointment, call 1-800-300-9300. That's 1-800-300-9300. Dr. Darrow will be back in just a moment. Stay tuned.